to clearly let everybody understand the fact that this training is being funded by Gavi, the Vaccine Alliance, and hosted by International Vaccine Access Center, IVAC, that is in Johns Hopkins Bloomberg School of Public Health, and coordinated by Direct Consulting and Logistics in collaboration with WAVA and NPSCDA. We want to also inform you that the funding for this training, yes, it is true that the HPV vaccine phase 2 covers for 21 states in Nigeria, but the funding for this training is specifically for now for 16 states. In other words, what it means is that 5 states out of the 21 are not included in the funding for this state, for this training for now. And those states include Borno, Edo, Zamfara, Ondo, and Niger states. We are still working with our funders to see if they can be benevolent enough to accommodate the remaining 5 states. Pending when we get that nod, we just want those people, participants from those states, to be informed. We want to advise that if they wish, they can continue in this training. There is no problem. No knowledge gained is lost. But where we eventually get funding for them, we will also let them know. But for now, the funding covers 16 states. And that is why we have selected 2 CSOs each from each of the 16 states, 2 CSOs. That is a total of 32 CSOs who are currently going to be funded for this training. So the remaining 5, like I said, we are still working to see if it's going to be possible to cover those states. When we do, we will let them know. But if they wish to continue this training to acquire knowledge, there is no problem about that. We encourage them to do. Knowledge, no knowledge gained is wasted. So that is the clarification I want each and every one of us to have. And I wish you a very beautiful and wonderful and interactive training, just like better than we had yesterday. Once again, you're all welcome. Thank you very much for joining. Enjoy the rest of the day.
All right, thank you, Dr. Chisa. Just to let everyone know that the attendance for today has been posted in the chat box, and everyone is advised to fill the attendance today. So before we go on to today's program again, I want 1 or 2 CSOs to remind us of the ground rules that were announced yesterday. Can anyone still remember what we announced for the ground rules for the program? Anyone?
Yes.
All right, thank you, Vivian. Thank you. Go ahead.
One of the ground rules was to always mute your mic.
Thank you so much. That's one. Another.
Thank
you. Yeah. So another.
Okay, but I mean.
That's the only one you can remember.
That's
so, okay,
all
right.
Yeah.
All right.
Hello.
Okay, so yeah.
Another ground. Can I talk? Chinyere Stella.
Yeah, sure, you can go ahead. You can go ahead. Yes, Chinyere,
okay.
You can go ahead.
We must raise our hands before so that we'll be admitted to make contributions. We must drop our comments via the chat.
Yes, thank you. Thank you so much. So, all right. Okay.
Each other's opinion.
All right. Thank you. Thank you so much. Thank you very much.
Okay. This is Courage. I want a Courage, the ED of Courageous Girls, Women and Children Initiative.
All right,
One of the ground rules yesterday was that we should respect each other's opinion.
We have to respect each other's opinion because we are here. No contribution is.
Yes, everybody's contribution is important.
It is. All right. Thank you so much. Thank you very much. And okay.
Can I?
You can go ahead.
Sir, thank you, sir. Good morning. No phone calls during the training. That's one of them.
All right. Thank you. So please, thank you so much. All right. Uzoma, iPhone. Hello, Zama, you can unmute yourself and then make a
Okay,
contribution.
one of the ground rule is if you're having technical issues or questions, you can contact
You should reach out.
Dr. Chisa.
Thank you so much. Thank you for that. Okay, Mary Ejo, you can unmute yourself and make a contribution. Hello, Mary.
One of the ground rules was also to endeavor to use a very quiet. Yeah, I'm here. One of the ground rules is to ensure you are in a very quiet. One of the ground rules was to ensure that you are in a very quiet environment where there are no distractions.
Very much. Thank you so much. Thank you. I think that's all we can take for now. And I think another important one, please let everyone rename their device by name and organization. Rename your device by your name and your organization so that I will not be calling people iPhone, Techno 247. Please, thank you so much. So, okay, so we'll go for to the second item on the agenda for today, which is the recap for day one. Dr. Chisa? Dr. Chisa?
Yes, Pius.
Mute yourself, please. Thank you. So we'll go to the second item on the agenda, recap for the day one. I think Dr. Chisa selected, I think, 3 sets. Hello? Are the people are the CSOs on this call? Please, if you're on this call, raise up your hands.
We lost your voice at some point. So
okay,
for what you wanted
thank you. Network. So I was asking if the CSOs that were selected to do the recap for today, for yesterday, for day one. So okay, I can see Courageous Girls Women's and then Adedeji, Adelanke Tope.
No, those are not the persons.
No, I'm not part of the team.
Bring your hands down, sir.
Bring your hands down, please.
I think they have questions.
Do you have questions, please?
No,
all right, thank you.
Sir,
thank you, Janet. So please bring down your hands. Thank you. So Dr. Chisa, please, can you name the CSOs that were selected to give it?
Dr. Judith Ani is already raising her hand. She's the one taking it today.
Okay, all right. Thank you very much.
So Judith Ani of Anambra State, Education and Research for Sustainable Development.
All right, thank you, Dr. Chisa. So please, Dr. Judith, you can go ahead and give us a recap for this.
Those they represent from. If I did.
We cannot hear her.
Good morning.
Yes, good morning. Good morning. Thank you. You can go ahead.
I'm meeting on much of today's training, and I go through the report for yesterday. Yesterday, the meeting started at 9 a.m., but to give room for others to join, the meeting started effectively at 9:13 a.m. The moderator, Dr. Chisa Igboleku, gave an introduction of the workshop, thus setting the agenda. The essence of the workshop, as she said, was to activate CSOs to help in HPV vaccination uptake in Nigeria. Afterwards, the ground rules was set by pharmacist Ekpe Maozo, while appreciating all present and thanking them for joining on time. Dr. Chisa Igboleku went ahead to tell the participants about the funders and partners that includes Gavi, the National Primary Healthcare Development Agencies, IVAC, state immunization officers, state health vaccinators, state health educators, and so on. After the introduction, the CSOs were prompted to fill a pre-assessment form to assess their knowledge about HPV in Nigeria. This was preceded by the facilitation given by the country director and assistant scientist at IVOG, Dr. Chizoba Wonodi. She took the participants on activities that will improve demand generation for HPV uptake in Nigeria. In this phase, as she said, 32 CSOs were selected to work in 16 states across the federation. In all, these 32 CSOs will constitute 32 master trainers that will train 320 vaccine champions that will work in 1,600 settlements across these 16 selected states. The expected outcome, as she summarized, to increase and improve HPV of better public health in Nigeria. Dr. Wamodi, in her facilitation, described the burden of cervical cancer in Nigeria and HPV vaccine introduction. According to her, cervical cancer is a major public health issue in Nigeria that and it affects the cervix, second most common cancer-related mortality after breast cancer. As she told the participants, apart from late presentation and lack of early detection, the poor health infrastructure is also a to tackling the which she used it to buttress the body.
So Judith, you may have to readjust wherever you are. Your location is breaking.
Sorry, Judith. You are breaking. You're breaking. We can hardly hear you. Hello, Judith. Can you move to a different location? We can hardly. I think your network is fluctuating. Okay, Dr. Chisa, is there who is the next among? I think we have. Hello, Dr. Judith. Hello, Judith.
Yeah.
No, we can hardly hear you. You've been we can hardly hear. So, Dr. Chisa, who is on that list again, so that the person can continue from where she stopped? Hello, Dr. Chisa.
Dr. Pius, on the contrary, she is the only one that is taking the recap for today. The rest are taking for the subsequent days. So it's one person per day for recap. So we just have to be patient.
Let me change my network.
Okay, all right, okay.
Let me change the network.
Okay, go ahead.
Let me change my network.
Let me try and change the network. Okay.
Let me swap the network for another one, just for like 2 minutes. Let me get another line.
All right, while we wait for her, please, let us try and rename our device so that we can know ourselves. There's somebody that is named 8839922356. Please, can you rename your device, please? Thank you. And there's also Techno 16. Please rename your device to your name and your organization.
Hello, Mr. Pius. Can you hear me now?
Yes, I can hear you. Please, you can go ahead. Continue from where you stopped.
Hello, sir. Hello, can you hear me?
Yes, I can hear you. You can continue. Thank you.
Okay, all right, all right. So, Dr. Wanodi went ahead to describe to the participant the different stages of the cervical cancer, the signs and symptoms, and the causes of cervical cancer. She mentioned that there are over 200 strains of HPV, but 12 are the high risk type. According to her, the preventive tips include vaccination, practicing safe sex, and regular screening. According to her as well, she went on to describe the World Health Organization global strategy to eliminate cervical cancer, which include vaccination, screening, and treatment. And these have been used in over 100 countries all over the world and has been shown to be efficacious and safe. However, she cautioned that like all vaccines, there may be some local reactions, but these are transient. And these include things like fever, redness, and in rare cases, anaphylaxis. But by and large, the vaccine has a high profile safety, she said. Nigeria, she said, is expected to sustain the effort. She told the participant that after this phase, the vaccination will be routinized into the primary healthcare system. But it is expected that before this time, girls who are 11 to 14 years should have been vaccinated. She rounded up her presentation by sharing a couple of key messages. Participants asked some questions that bordered on the pathways to infection, why the age range of 19 to 14 years, the research on longitudinal and clinical trials, what treatment and vaccination frequencies, and how long the vaccine will last. Answers were provided to all of this. After this session, there was a breakout where participants were randomly assigned into 10 different rooms to answer 4 questions that were posed. This dovetailed into the next sessions that was facilitated by Ms. Muamaka Ezanya, where she made presentation of frequently asked questions on HPV vaccinations, as well as what to do and what not to do when CSO encounter a hesitant person. Questions were also asked and answers provided. At the end, the training ended successfully with a closing prayer that was said at 2:14 p.m. Thank you very much.
All right, thank you, Judith. Do we have any addition from the house? Is there something she missed? Please raise your hands if you have any contribution from yesterday, any contribution to make from yesterday's training. All right. All right. Thank you so much. Thank you, Judith. Thank you very much. Thank you. That was a fine recap. So we'll go over to the next section. That will be taken by Tosin, and then will be supported by Adi Faria. Tosin, over to you, please.
Good afternoon, good morning, everyone. I don't know if you can see my face. My name is Tosi, like Pius has rightly mentioned. So I'll be taking you on community activation for the introduction of the HPV vaccine. So if Donald, can you give me permission to share my screen? Thank you. All right, just sorry, 1 minute. I'm just trying to share my screen. Okay. Okay. Can everyone see my screen?
Yes, Tosin, we can see your screen.
I don't know. I'm having small technical issues. Just a minute. Sorry about that.
All right, thank you. Wait for you. Take your time.
All right. So can everyone see my screen now?
Yes, we can see your screen.
Yes, yes.
Okay, awesome. So, like I rightly said, I'll be taking on community activation for HPV vaccine introduction in Nigeria. So before we start this session, I would like to ask, can anyone, because community activation is something that, to me, I just feel like something that is like more like a discussion, not necessarily a presentation, because we are all CSOs. Like most of us have been in the community. Some of us are still presently in the community. So this is more like, should I say, a brainstorming session, so to speak. So I would like to gather as much feedback from everyone as much as possible. So this is more like an interactive session. So I would like to ask, what are the key steps for effective community engagement? Can somebody just give me an idea of what they think they know about? What do you think you need to have? Okay, I can see Adeleke, oh, and Mr. Kola. So I think Adeleke, you can unmute yourself.
Okay. Thank you, Tosin. For any programming, for any project, there are 3 phases in a project lifespan. The first phase is entry phase, the second phase is intensive phase, and the last phase is exit phase. Each of these phases has its own activities that is particular to that phase. If you miss any, the project won't be successful. Can you hear me?
Yes, I can hear you loud and clear.
Okay. So during the entry phase, that's where you want to enter the community. You have already do your stakeholders mapping, you understand? So this particular project I want to do, who are the likely stakeholders that I need to meet with that will assist me in successful project implementation, in making sure that everything comes out successful. So then you do advocacy when you map your stakeholders for that particular project. That's particular people that you know will help you in that. And advocacy, that's the entry phase thing. Where you meet with the stakeholders, gatekeepers, community leaders, people that will assist. So, like this one that is health related, you meet with the maybe primary health facility, maybe local community, people that are in health that can assist you, make relationship with them, discuss the project with them, what you want to achieve. Then when during the entry phase, you can also do dialogue, community meetings, dialogues to discuss community how you want to run the project, so that people you have enough support for entry into the community.
Thank you so much, Mr. Adeleke. That was very, very good. Honestly, I feel like we should really Yes, Mr. Adedeji, yes. Thank you so much. I feel like we should be co-presenter. So because of our time, I will move to the next question. So you kindly raise your hands if you want to make your contribution. What are the common challenges you face when in community engagement? So what are the common challenges? I want a woman this time around. Courageous Girls, Women and Child Girl Initiative. Yes, please. Can you speak? Can you unmute yourself?
Hello, good morning.
Yes, good morning.
Yes, one of the challenges we face in community engagement is resistance.
Okay.
Yes, resistance from the people. For instance, you're entering into a community and you're taking a message to the community. Definitely, these people, they live their life in a certain way, they believe in a certain way, they act in a certain way, and because they don't even fully understand what you're bringing, language may be a barrier too. So they tend to resist that which you're bringing.
Okay.
So in order to really help to curb this, which is a challenge, you get in a stakeholder from the community, among the community, somebody who knows their language and knows everything about them.
Okay, thank you so much. Courageous girls and women and child. That was very, very insightful. Thank you so much. I'm glad that, like I said, this is more like an interactive session. So I'm glad that you're all bringing in valid points into this conversation. So I'm going to dive into the session now. Okay. Okay, so what comes to mind when you hear about community activation? Community activation, like some of you already know, it's like a set of people living together in a community with common interests. They have the same belief, they have a lot of similarities, so to speak. So, like I said, a lot of us already live in a community, so we know what it is to be in a community. So when you now have people that already have similarities in everything they do, how do you activate them? How do you enter into the community? Like Mr. Oladeji said, there are 3 phases in any project. So we are going now, as we are introducing the human papilloma vaccine, we are entering into the community. So what are the essential things that you need in order to enter into the community? People that are already similar in a lot of things, in religion, occupation, and they have a diverse ways and similarities in everything they do. So how do we enter into that community? So that is why we are talking about community activation. It's a way of you engaging the community, because you are CSOs, you are entering this community and you want this community to be the owners of this message, of this human papilloma virus vaccine message. Like before this training started, a lot of us did not know what it is, why this vaccine is being introduced. Didn't know that, cervical cancer was killing a lot of women. From the survey we had yesterday, a lot of people didn't know that it was killing over 8,000 women in Nigeria. So the fact that we now have this idea and we want the community to be activated, we want to use an approach that will empower them so that they will know that and we don't just use this approach, we want to know what is their need. What do these community members need? Did they understand the impact of HPV virus in the community? Did they know how severe the HPV virus is? Did they know how important the vaccine would be? So we want them to own this intervention. We just don't want to enter the community. We want to understand what does it take, what is their need, and how do we enter into the community so that they will be able to gather their support and they will take ownership of this human papilloma virus vaccine without interference, without support. I will give you an example. There was a project we had 2 years ago. It was a RAISE project. It was about sexual and reproductive health. So we noticed that before the project started, before we entered, we had to obviously do our baseline analysis before we realized that they were really in need of this of the sexual and reproductive family planning method that we were bringing. And by the time we were leaving, we realized that a lot of them didn't want us to go. They were already used to us in the community, and they were even the one advocating for the importance of family planning in the community. Whether we were there or not, they carried on doing the sensitization by themselves. So this is what we are saying, that you enter the community by knowing what they need and activating them. Now that you're introducing human papilloma virus vaccine, we want them to gather their support and enable them to be able to empower other people and explain and sensitize them without much interference. So that is why it's important for you to attend this training, so that you get all the knowledge you need. And if you're entering the community, you are well equipped in sensitizing people. You know, there are some times that if you enter a community the wrong way, they can frustrate whatever you are going to do. The community members have that power to make your project not to be as successful as they want it to be successful. So that's why it's very important for you to know what this community is all about before you enter the community. And what are the benefits of doing all this? You better understand their need. Like I said, you become like an asset to them, because then they already know you. they're already familiar with you. They know what is important, that you really care about their need. Not that you're just coming to impose your own agenda on them. They know that, oh, you really care for them and what they're all about. So that's why it's very important. Community entry, the right strategy for community entry is very, very important. Then you are increasing their participation as well. You are involving them. And this will ultimately lead to the success of the program. Like I said, if a community does not want your project to be successful, no matter the Turanshi or the English you speak, it won't be successful. Then it will improve ownership. We want them to own it. We want them to, there are some women that I like to call them apropos women, that they will carry their neighbors' gist more than, like, as if it's their own gist. They will carry it more than it's their own. They are so committed. They'll say, I feel like what happened to Sister Nkechi, and they carry that rumor or that message so powerfully. So we want them to take ownership of this human papillomavirus vaccine. We want it to be so important to them that they spread the message in the right way. I see Emeka raising his hand. Is this an old hand? Emeka Chukwu. If you can please read, if it's an old hand,
it's an old hand.
Okay, please put.
It's an old hand. Let me remove.
All right, thank you. So you can improve the capacity of the community. Like some of you did not know how severe human papillomavirus vaccine was until you came for this training. But when you go there, they are more equipped. They have better understanding and better knowledge. Then at the end of the long run, you are improving health of the family, health of the women. And we all know that women are builders. We don't want any of our sisters dying of cervical cancer. We don't want any of our mothers, our cousins, our nieces. We don't want anybody dying of cervical cancer. So these are how important it is when they already understand and they know how important it is to get the HPV vaccine. So when you want to enter the community as a CSO, you have to plan. We all know this. Like I said, we're all community members already. We've been to the community. We are even presently in the community. You need to plan and prioritize. You need to identify who are the people I need to talk to. I'm not just going to this community unprepared. I'm not just a farmer going without cutlass to the farm. I need to know what is important to me in order to make sure that my program is successful and these people are well equipped for the introduction of the HPV vaccine, which will be introduced shortly. So you need to know who are your relevant stakeholders, like Mr. Adedeji mentioned. You need to know who are the influencers in the community. And because this vaccine is gender sensitive and is age sensitive, so there are some certain people that you need to talk to. But at the same time, even though it's gender and age sensitive, you need to also consider other factors like the caregivers. There are some communities, if you don't involve the men, the daughter will not get the vaccine. If you don't involve the the parents, daughters will not get the vaccine. And there are some also other communities as well that if you just talk to the head of school, they can easily send the message to the daughter, and within their peers, they can accept the vaccine and everything will be fine. So we all know how diverse Nigeria is, how different things can be. So when you are you want to talk to the general group, please, whoever is unmuted, please kindly mute yourself. If you want to talk to the general group, you need to focus on, if you are focusing on the caregivers, you need to talk to the traditional birth attendants. The way you're talking to them about immunization. Oh, if you go to any household, you see girls within age 9 to 14, kindly sensitize the parent or the caregiver or the father or the mother and tell them about the HPV vaccine. The prominent head of families, there are some families that once the prominent head of family is okay with anything, the family will generally accept it. They don't fight the prominent head leader. They don't challenge him. So, and there are some traditional and religious leaders like the church. Whatever the pastor says and whatever the imam says, they follow. So it depends. Communities are diverse, and they're very diverse in when you're trying to plan your strategy. So you have to plan, who do I need to talk to in this community. That's why it's very important for you to understand the community and know the needs, like I said in the previous slide. So if you know the healthcare workers are the people that this community listens to, or the vaccination teams, then you need to know how you sensitize them about the importance of the HPV vaccine. Remember that you can say, oh, healthcare workers should know how to sensitize people. Remember that there are other vaccines that are being given. It's not just the HPV vaccine that the healthcare worker is given. But in order to for them to also prioritize HPV vaccine, you need to communicate with this. Then we have world development committees. They're also very, very important in the community. So that's if you want to target the caregivers or the adolescents. But there are specific groups. If you want to reach the caregivers, that's the head teacher. The school authorities can talk to the parents, where maybe during their PTA meetings, on the importance of getting this vaccine. And if it's the adolescents too, you need to talk to their groups, the youth leaders. Those are the people that can influence them. There are some situations whereby the parents might want the child to collect, and the child does not want to collect. We've all been teenagers before. Remember, this is a specific category of people who are giving to. You can say there are sometimes, I don't know if some people did this, but there are people that have said to their parents they want to buy biology, and they are getting 2 books, or they say, oh, there are some parents that are not so focused or so in depth into their parent and their kids to know what they are doing in school. You can say, oh, the mom can tell your daughter, go and collect this HPV vaccine in your school, and the doctor can say, I've collected it, and there's no way for her to verify, or she can get, all those. There are so many tricks that teenagers play. That's why, as much as you're focusing on the caregiver, you also need to focus on the adolescents as well, and ensure that they are properly sensitized through the youth leader, even their peers, because peer pressure can make an adolescent not want to take this vaccine. Okay, so I'll move to the next slide. So if you are going into the community, there's a community activation template in mapping key stakeholders. I like what Mr. Adinich said. It's like as if you flipped through my slide before this training. So we have this community activation booklet. I don't know if everyone can see my screen. Can everyone see my screen?
Yes, we can see your screen, Tosin.
Yes, we can.
So we have this community activation booklets that are prepared by the IVAC team. Why this booklet is very, very important is it assists CSOs in planning and mapping their community stakeholders, key stakeholders. So it even gives you like things that you need to do when you're about to engage a community. Like some of the things I mentioned, I've talked about in this training are also in this community activation templates. But the the frequently asked questions are also here, like we discussed yesterday. What do people feel about the HPV vaccine? How do you respond to them? All these are inside the community activation templates. But the part I want to go to is this stakeholder mapping template, which is a similar template to what you are seeing on your screen. So this template talks about like the traditional leaders, what you need to see. So we are going to fill out these templates. We'll see how we'll get it across to you in your various communities. But this was used in phase 1, and we're hoping that you'll be able to use it as well in phase 2. So these templates assist you in mapping your stakeholders, and it makes you know which category of stakeholders you are using, the contact person, who are you going to speak to. Then you need to know how influential is this person. There are some people that, yes, they are well known in the community, but people don't listen to them. So not because somebody is influential, so the person is well known, so to speak, doesn't mean they are influential. So you need to know how influential is this person. If people really listen to this person, or this person just a figurehead, so that they say there's a leader in the community. So you need to understudy the community, know how influential they are. So these templates, what is showing on your slide is already in this booklet for you to use. So You need to know how the stakeholders will contribute to the projects. Can they ensure that every girl, so I've kindly fill out some of it for you so that you can see, can they ensure that some of the girls in this community is vaccinated? Would they, like I mentioned, be able to carry this message without less support from you? So without so much interference from you, and they on their own, can they carry out and ensure that from every girl in the community are vaccinated? Then what strategies are you going to use? Are you going to use sensitization, dialogues, focus group discussion, rally, or their monthly meetings? Some communities have monthly meetings where you can talk to the men separately. You know, do you want to then also, what is their own recommendation? Because it's like I don't know if anyone has heard of co-creation. It's like an interactive session. So you don't want to impose on them. They need to give you their feedback. They need to give you their recommendation or the best time. So take, for instance, now the Muslims are in their Ramadan fast. So you want to ask the community leader, when is the best time you want to conduct mobilization activities? Well, would they advise you? Most likely, they might advise you to come very early in the morning where they are still attentive. You don't want to go and meet somebody that is breaking their fast and say, oh, okay, oh, there's this HPV vaccine I want to give to you, and they'll be looking at you like, are you serious? I'm trying to eat here and you're talking to me about vaccine. Or like some people say, in a vaccine I go chop. So you don't want to irritate people when you go there with the wrong time. You want to make sure that you go there with the right time. And the best people that can give you this information are the community stakeholders. So that's why it's important for you to map them and also categorize them using these strategies to ensure that you get the right stakeholders to spread the right message about the HPV vaccine. Okay, I'm trying to change my slide. Okay. All right. So for the master trainers, which are you, you guys are the master trainers, the CSOs. I'm sure my colleague will talk about the vaccine champion in the next session. You are going to be training vaccine champions that are going to assist you, who are already residents in the community, are going to assist you in this community activation. So, but when you are going, what are the requirements you need to train your vaccine champion? You need a community active HPV banner. I don't have the banner here, but I have this IDC materials. I will still show you clearly later on, but we're going to, there's a banner, the HPV banner that you need to, so that you can show them some of the things that are being presented. You obviously need this community discussion guide, which has the stakeholder mapping template. It also has the activity planning templates. This is also in this booklet. There's an activity planning template. There's an activity reporting template. Then your writing materials, then a good device to capture pictures and events. You know that you are still going to be giving us feedback to the IVAC team, be giving the IVAC team feedback. So it's important for you to document your work as much as possible. You don't want to get to a situation where we've had last year where some CSOs say they are working, but there's nothing to show for their work. So ensure that you capture all your activities as efficient as possible. Then we also, if possible, there are some instances you might need to provide maybe even a sachet of pure water or even a bottled water. We know how the weather is presently. So anything that you need, you know, that will assist in your training to make sure it's as effective as possible. You have to ensure that you do that during your training of your vaccine champions. So
you have 7 more minutes.
Oh, okay. So let me run through it. So we have to meet with the second step is to identify key stakeholders to gain their support in your engagement. So like I mentioned earlier, you need to determine a convenient and the right venue to meet them. You need to collate, ensure that you carry enough tools in your engagement, like your discussion guide. Seek for their opinion. It should be more of them talking and you just trying to explain. Both of you should be talking, but you also need to allow them to speak and get as much information from them as possible on the best community engagement approach. Then you need to plan your activities with them so that it will increase ownership. So when you're planning your activities, ensure that it's together with the community stakeholders, key stakeholders. Then also document their supports. That's why we're giving you some of this book, but you can also, there are other tools that will be provided as well, aside from this booklet, for you to document their support and their feedback. Then also, when you are entering the community, sorry, 1 second. Okay, so it's crucial for you to build relationships with the healthcare workers. You want to build relationships with these people. You don't just want to enter and after your project is, or after a certain period, you stop having conversations with them. You need to meet with them separately. Each categories of stakeholders, you need to meet them separately. Like the way you meet with the healthcare worker at their certain period is different from how you meet other key stakeholders. So it must be separate. Then effective community entry is to ensure that you link every eligible girls to the vaccination teams, that all that will still be discussed in details in the next session. Each vaccination teams, eligible girls should if vaccination teams should have access to eligible girls in your community to increase the outcome of your community engagement. Then in some communities, you can talk to the men and the women. Please, can you mute yourself, whoever is unmuted? So in some communities, some you might need, there are some communities it's okay to speak to both the men and the women. They are fine with it. There are some communities you can even talk to the entire family together, but there are some communities it's better to separate the women from the men. There are some things the women want to ask, and even especially this for this vaccine, we encourage that you separate the women separately, because it's a gender cervical cancer is a gender disease, is gender specific. So you want to talk to some women separately and ensure that they are free to communicate with you in any questions they can ask freely when you have a separate conversations with them. So because of my time, I might have to be rushing this slide. So you want to conduct your activities you first need to determine the details of the activities. So every activity they are going to be conducting in details, you have to fill it out and you have to explain which activities will be most effective. So there are some activities, maybe you go through in a naming ceremony, you know how many people you can target through that, unlike when you go for rallies where you meet more people. So you have to plan the resources you have and make sure that you engage the most effective activity within your community activation planning. So also, what are the materials you need? You need IEC materials, a public addressing system like a microphone or a speaker in case you are talking to a large number of audience and you need to, your voice might not be able to capture everyone. Then you need a good capturing device. Like I said, you need a note taker from your team that can take and document everything. So we know devices can crash, phone can fall into water, but somebody that is writing, you can always refer back to that just in case you can't capture everything on your devices. Then obviously transportation for your tools and your team members when you're going for your community engagement. So all these are very, very important in your community activation. So these are the samples of the IEC materials that I said. So I don't know if everyone can see my screen. This is one of the IEC materials you're seeing on your screen here. So we use this for phase 1. So these are some of the materials that you would be using during your community activation. Then I also want to say that we would do our best to give you an introductory letter when you are going to your communities to explain why you are going to that community and what you are going to do in the community. Then you document the outcome of every activity. So you've planned your activities, you've determined the activities you want to do. Now, what is the outcome? Was it successful? What type of activity did you do? So like, for example, now I've put today's dates, today's activity, I want to conduct advocacy visits, my target audience are the adolescent girl. Where am I going to meet them? I put it, is it school? Then how many number of people did you reach? How many of the males or the females? All these important details are there. I will give you an example. The reason why we will say, oh, why are the males here or the boys here? Because is it not a gender vaccine, or is it not, this vaccine is not for adolescent girls? So there was a time during last year when we went to the community and I've just given this as an example. So, and we went to meet were talking to community members on the importance of the vaccine. Then there was a boy that, because of the fear of injection, said, oh, they are going to give injection on so day in October 2023. Everybody run inside, don't allow them to inject you, don't allow them to put injection in your hands. And people among his peers, even though it was a young boy, among his peers, they were all afraid and they were all running inside their houses. So you can imagine that even though our targets are the adolescent girls, we had to call the boy aside and educate him that, oh, you don't want your sister to be sick in the future. You don't want your mother to be taking your sister to the hospital and they will not be able to take care of you. So allow your mom or your sister to collect this vaccine. So that's why you don't want to neglect anybody that's important within your community. So you can talk to the boys, you can talk to the men. Everybody, as much as possible, are important in the uptake of this HPV vaccine. So these are the things that you would have to fill out after you conduct your community activation activities. Then also you will share your reports with the IVAC team using some of the materials I've shown you, and also there will be a session on ODK that you will use to collect data when you go to the field to conduct community engagement. So that's all I have for now.
All right, thank you, Tosin. Thank you, Tosin. Before we go into the question and answer, I just want to appreciate the presence of our senior colleagues from the NPCDA. Comrade Gerald, you're welcome. Madam Jimmy, I see you and I hail. And our colleagues from the state also.
Pius, I can't hear you again.
Sorry, Tosin. So if you have your questions, raise your hands. We'll be taking the questions 3 at a time. She'll respond to 3. After that, she'll take the next one. So before you go for that, I have a question. So in mentioning the people that are very important that you would see when you get into the community, that you have to see that influence and the change by same behavior of people in the community. You didn't mention religious leaders. Are they not important? And then secondly, also when you said we're about to you want to activate yourself in the community or you want to go into a community, what are those important things?
Dr. Pius, I can't hear you again. Okay, so I can't hear you.
Okay, so I asked a question. Are religious leaders not important when you go into the community?
Okay.
Are they not influential?
I got that message. The next question, the second question.
Okay, so the question is the steps for you to take before you go into a community. What are the things? Because in rural communities where we live, there are things before you go. They have this set of belief that their gatekeepers are very important, and the gatekeepers are influencers. If the gatekeepers will not say we should enter into this community, they will not allow them to enter the community. So are these steps not important in this case? Thank you.
Okay. All right. Dr. Pius, thank you so much for the question. I'll start with your question. I don't know if you heard me correctly, but I mentioned religious leaders are
yes, we
very
heard
important. You. Thank you so much. I remember even making reference to pastors and imam in the community. So I don't know, maybe your network was buzzing when I was saying that part. Then also the the steps. That's the summary of all what I've been talking about, from the planning or mapping of stakeholders, knowing how important the community gatekeepers and the stakeholders are. So all that steps, I mentioned each steps on the whole presentation. So thank you so much for that.
All right, thank you so much. So the first person is Doris Igwe, ACDI. Unmute yourself and ask your question.
Okay, good morning, madam. Thank you for a wonderful lectures. I don't know whether you're hearing me. Good morning, madam.
Yes, I can hear you.
My question is very simple. Who are the vaccine champions? Are they going to be taken from the community, or we can just pick anybody and train as a vaccine champion? Then the full meaning of ODK. The second question, what is the full meaning of ODK? Thank you, ma.
Okay.
All right, listen. The next one is Victor Correyo. So we'll be taking 3 questions at once.
Can you hear me?
Yes, we
Yeah.
Okay, my name is Victor Correo, the Executive Director of Abraham Children Foundation, Ashiko, Ebonyi State. I have 2 questions. One is a request. We need a template after this training. Then secondly, I want to say that, make a suggestion. Is there no need to encourage more girls between the age of 9 and 14 to actively participate in taking this vaccine? Would there be any incentive to be given to them after taking it? Because the turnout will be much higher if after taking the vaccine, any little incentive is given to them to appreciate their presence. That's the 2 things I want to ask. Thank you.
Okay.
All right.
Thank you.
Thank you, Mr. Victor. The next person is Adedeji.
All right, thank you, Doctor. Adedeji Adelake from Community Health Advancement and Rural Empowerment Center, Care Center in Ado-Ekiti, Nigeria. My own question is an observation also, because during the training, the session with maybe Dr. Pizza or the second facilitator yesterday, that we trained world vaccine champions, 10 world vaccine champions per LGA, you understand, per local government area. So, for example, in my home state, in Ekiti State, we have about 16 local government areas, you understand. So, and based on what you told us that two NGOs per state. So there are some states that they have almost 20 LGAs and above. So how are we going to manage, you understand? Or are we not going to do all the sensitization campaign, all the LGAs in our states, or what are your expectations and what are the things needed? We are targeting community and the structures in the communities, maybe churches, mosques, community members, different community inside the communities, maybe church community, religious communities, and even market women, school communities, things like that. So this very enormous, you understand. So what's your plan? What are your expectations? What do you need to do that we can plan ahead and for resource-based programming? Thank you.
Okay. All right. Thank you so much, everyone, for all your questions. They are all valid questions. So I'll start with the first question. Are the vaccine champions going to be taken from the community? The answer is yes. So we want people that are already in the community that are influential. I don't know if you remember where I was sharing the community template on prioritizing how much is their influence. So we want people already in the grassroots, people that they tell you, we are taking this vaccine and it's very important. If you convince them, they know how to share the message with their community members and they are ready to collect the vaccine. So yes. So the vaccine champion will be treated in more details in the next class. So the ODK is open. You asked for the full meaning of ODK. The ODK is open data kits. So that is you can feed it online. So one of the reasons why we are using that, although that section will also be treated later on. So one of the reasons why we were recommending ODK is because we understand that there can be network challenges sometimes. So you can be in the field and you can fill up your data and you can send it to us when you have access to network. So that's the full meaning of ODK. So it's open data kit. Then you said, the next question was, can we encourage more girls to take the vaccine? Unfortunately, the vaccine has to be within age brackets of 9 to 14. And the reason why is because the vaccines are not in supply. I know there are plans for the Nigerian government to still start vaccinating boys in the future, and all those things will be treated in the FAQ questions in case people ask, why are you vaccinating only between 9 to 14? So that is already is because we don't have excess supply of the vaccine. So that's why we are focused on this group for now. So once there are more vaccine, HPV vaccine, I'm sure we can carry more girls along. In terms of incentives, it's not our policy, or is not always encouraged to give people things in order to collect vaccine, because it's things of the health. So for example, look at this, you are giving somebody polio vaccine, the health worker comes to your house and just drops it in your child's mouth. You don't give them the child incentive for collecting that. So if you want to start giving people incentive, it's like you're starting a race you can't finish, because before you know it, they start asking for more things, and we try to discourage giving people incentive in order to collect vaccine, because the vaccine is already helping you. So, but there are other ways you can encourage them, maybe on your own. If you choose to have a dance challenge with them, make it fun. Maybe the teenagers, adolescents like to dance. You can just dance around. That's just my own example of how you can just encourage them without using financial incentives. So, the other question is, okay, for the vaccine champions, for states, Ekiti State that has 16 local governments, like you rightly mentioned, this will be discussed more in details in the next class. You are trying to manage resources. So the next facilitator will teach you how you are going to map out the LGAs that you are going to use to raise your vaccine champions, in order to, because the resources, they are scarce resources. So we are going to teach you how you're going to manage the resources you have in order to map out the right local government LGAs to raise your vaccine champions. So yes, so I will take 3 more questions because of our time. So next, over to you, Dr. Pius. Yes.
Thank you, Tosin. So just the last 3 people to ask questions. Philomena, please, can you mute yourself? Thank you. So
Dr. Pius, I can't hear you.
Okay, we will take 3 more people to ask questions. We have Uzoma, Center for Family Health, Olubumi Awe, and then Bikolin Chibundu. Thank you. So, Uzoma, please, you can ask your question.
All right. Thank you, Doc. My name is Uzoma, Center for Family Health Initiative, Imo State. Mine is really not a question, but an observation. Ma, I don't know if you go back to your previous slide where you're talking about community activation key steps.
Okay.
Hello, Ma. Okay, yeah, you're talking about, I don't know if it's my screen or my eyes were following me. We're talking about community. We're talking about community activation, how to show our presence there. So I saw world development committees. So I don't know if it's the World Wide Web, like the word, or the word, like WARD.
Okay, this is what you're, is the world, World Development Committees.
Okay, it's like word, like community word, or the whole world per se.
Okay, no, okay, it's a community word.
Okay, that means it's a typo error there.
Yes, thank you.
All right, thank you, ma'am. Thank you so much.
All right, thank you.
So the next question, Olubumi, please, you ask your questions. Olubumi, are you there? So we have time for only 1 more person after Olubumi. Please, you can go ahead and ask your question.
Can I speak, please?
Okay, we can't hear Olubumi. So
can I speak? This is Christy.
Yes, you can.
Go ahead. Yes, go ahead.
Thank you very much for the beautiful presentations. In fact, we had a lot of take-homes from that presentation. I just want to speak in line with the incentives. I think you gave polio as example. We have participated in polio vaccination before. It's not incentives per se, it's pluses. We have pluses for children, something like sweets and whatever, just to attract them, because some children at times will not respond until they see things like sweet and so. So we call it pluses, not incentive.
I can't. Your line is breaking, ma.
We can't hear again.
It's like I was muted.
For the brilliant presentation. Yes, I'm with you. And I think brilliant. Oh.
Okay, maybe we should take the next person. I can't
Yes,
hear.
you can go ahead. Let the next person ask a question.
Okay,
Good morning.
yeah, good morning.
Good morning.
Good morning.
My name is Olubumi Awel, Living and Social Development Foundation. Thank you for the brilliant presentation, ma'am. My question is, when we are choosing these champions, are we involving boys in the training? Are we training boys and girls as champions?
Okay.
Or the influencers alone?
Okay. Okay, so
well, let the last person ask. Tosin, let the last person ask this question.
The last person already. Okay.
Colin, please, you can ask your question.
Okay, yeah, good morning. My name is Chibondo from Imo State, Better Community Life Initiative, Becolin. Yeah, this vaccine has target growth 9 to 14 years. And the emphasis has been community, community, and community. Whereas some of these target groups, some of these girls are living in boarding school. So do we only go to communities or focus on community, or do you also go to these special areas where we can find some of these girls, like schools, like boarding schools? So that's my question. Thank you.
Okay, Tosin, that's all we can.
All right.
That's all we can take.
All right. So thank you so much for all your questions. I really appreciate them. So I'll start with the last question. So the community is not just restricted to settlements, going to schools as well. That's why if you remember when I talked about mapping the key stakeholders, I put head teachers and school authorities. That's because I want us to also focus on going to schools. So we are using an approach for this HPV vaccination, which are the school-based system and out-of-school-based system. So we are focused on both systems for the activation of the community. So it's not just focused on only settlements. And also to the second to the last question about the pluses that you mentioned. I made reference to polio vaccine because sometimes you take your children for immunization and you don't give them things, or you don't give the parents incentives for bringing them for immunization. And I'm also trying to limit, but if you have anything you want to give them from your own pocket, feel free to do that. But it's just that we already have this project already has a budget, and at the same time, we are trying to reduce giving people incentives for vaccination. It's not a practice that we encourage at all. Then what's the other question? I don't know if I can remember the last question, but those are the two questions I remember correctly. I think that's all.
Thank you, Tosin. Thank you, Tosin.
Remember,
sorry, please. Madam Olubumi, sorry, I thought you asked your questions. Chima, sorry, that's the last question we can take. Donald, do you have any? Donald,
Okay, yes, sorry, I remember, sorry, Pius, I remember Madam Olubumi's question. The reason why I didn't even want to speak to is because my colleague will discuss more about the vaccine champions in details. And I'm glad that I've been able to whet your appetite for the next session. So she will give a more detailed explanation on the vaccine champions. So that's for Madam Olubumi's question.
So Pius, the last question was about if you're going to employ only girls for the vaccine champions or both girls and boys. So Tosin, please answer.
So that's what I just said now. My colleague, this is community activation session, not vaccine champion session. My colleague will discuss more in detail about the vaccine champion in the next session. So I'm glad that all these questions are coming up. So everybody's eager to listen to the next session. So
thank you, Tosin. Thank you for your effort. Well done. So before we go to the next question, just want to add to what my colleague just said. We and our partners at NPCD, we try to dissuade people from giving incentives to community members. I think we have only one organization. What's the name of this organization that try to advocate for vaccine by giving people incentives in different communities. But at MPACD and at IVAC and DCL, we do not do that. Thank you. So we'll move on to the next section, which is selecting ward settlements and vaccine champions. CSO training approach to be taken by Dr. Chisa and supported by Donald.
All right, good morning, everyone. Just give me a few minutes to share my, give me a few minutes to share my screen and we'll come on. All right. Can you see my screen?
Yes.
Yes, we can, Dr. Chisa.
Yes.
All right. Thank you very much. I want to start by appreciating my colleague, Tosin, who has just stepped down from the facility, who just facilitated the last presentation. To a large extent, she has made my work very easy. And sorry, is it better now?
It is, Dr. Chisa.
It's better now.
All right, thank you very much. So I was appreciating my colleague Tosin for making my work easier because she has mentioned a lot of things that I'm going to be talking about. For this training, for this session, I just have about 30 minutes. I'm hopeful that we'll keep to time. Permit me to say that this is the most technical aspect of this training. I would want you to pay very serious attention to the details of this session. That way you'll be able to understand exactly what is expected of you. Now, this session will take care of the key steps that you are going to use in selecting your vaccine champions. Somebody already asked, who are these vaccine champions? In this training also, we are going to tell you the qualities of a good and efficient vaccine champion. And we'll tell you how you are going to train your vaccine champions, and we'll also enlighten you on the expected deliverables from you. We're also going to talk about Y2LGS. As a matter of fact, I'm going to start with Y2LGS. Now, I did announce yesterday and today that this training is funded by Gavi, the Vaccine Alliance, through IVAC, International Vaccine Access Center. These are international organizations who are benevolent enough to sponsor Nigeria. My prayer is that Nigeria will soon become rich enough to take care of ourselves by ourselves. We are still being colonized. That's by the way, anyway. Now, these people are only able to fund 2 LGAs in one state. They did same for us during phase 1 state. We also funded 2 LGAs in 1 state out of the phase 1 states. Same again, they are repeating, they are funding only 2 LGAs in 1 state. That goes to say, Nigeria, you can take care of the remaining LGA. We pray that our country will be able to take care of ourselves very soon. So that explains why we can only do these activities in only 2 LGAs in 1 state. We are conscious of the fact that each state has almost about 10 LGAs or more. So that explains that. Thank you. Now, you see, we keep mentioning since we started this training that there are 32 CSOs. These 32 CSOs have carefully been selected from 16 LGAs. I announced in the morning why we selected 16 LGAs. It still boils down to the funding issue. So 16 states have been selected. So the 16 select states, we competitively selected only 2 CSOs from each of the states. Only 2. So if you check in any of the 16 states we have mentioned here, we have just 2 CSOs. Trust me, more than 20 to 30 CSOs applied in 1 state. For a state like Kaduna, I had nothing less than 50 applications. So that is why you have to consider yourself very lucky to have scaled through. We went through a lot of stages of screening with NPS, CDA, and partners to be able to arrive at this selection. So we are hopeful that these people that have been selected will, stand up to their responsibilities and deliver as expected. So now, that is why we have 32 master trainers, because we are training 1 person, supposedly, from each of these CSOs that have been selected. So 2 times 16 will give us 32. That's how we arrived at 32 master trainers. So if other representatives join from the same organizations we have selected, no problem. You are just joining, but we are conscious of the fact that we have 32 master trainers. So these 32 master trainers are expected to go on after this training and select 10 words from each LGA. In other words, each of the CSOs in every state, for instance, if I come to Anambra, I have 2 CSOs in Anambra. 1 CSO will work in 1 LGA. Another CSO will work in another LGA. We are going to arrive at the criteria for selecting those LGAs. So, the CSO working in, please, can somebody give me a name of an LGA in Anambra? Anambra CSOs, are you here?
Yes, yes. Idemili North. Idemili North, LG.
Good. Another one?
Nnewi North.
Nnewi North. Thank you very much. Now, one of you will work in maybe Idemili, maybe Nnewi. It depends on the decisions you take with the state level. I'm going to go to that in the next slide, right? So when you come to, assuming you're going to work in Nnewi, when you get to Nnewi, we might have more than 10 LGAs. They might have up to 15, 12. It depends on them. But you can only select 10. The reasons I will explain in the next slide. You can only select 10 words from the LGA where you have been assigned to work in. I hope that is clear enough, right? Because that is what you're funding. The reason being that that is what your funding covers. Now, these 10 vaccine champions, in these 10 vaccine champions, you are going to select each of them from each of the LGAs. You remember I said you select 10 LGAs. And from each LGA, you select 1 vaccine champion, making it 10 vaccine champions. That is how we arrived at these 10 vaccine champions, 32 of you. That is what gave us 320 vaccine champions. So these 320 vaccine champions will go ahead. After you have trained them, they will, on their own, select 5 settlements from their wards. I want to believe that every ward have settlements. Nnewi is a local government. The Nnewi person, please, can you mention a word for me in Nnewi? Idemili, can you give me just one word from Idemili, please? Quickly.
Mpo word 1.
Mpo word 1. Thank you very much, sir. If we select Mpo word 1, Mpo word 1 has settlements. So you are going to the vaccine champion in Mpo word 1. We select 5 settlements. We call them 5 unique settlements. They are unique for some reasons. It might be that these settlements don't always have, they have 0 vaccination in these settlements. In other words, either vaccinations don't go to them, or they don't have a lot of their children being vaccinated, or these wards are large. They have the population we are looking for. We can choose them. There must be some reasons that makes them unique, which we are also going to treat in the next slide. So by the time each of these 10 vaccine champions select five settlements, they will also select one vaccine champion from each of the settlements. So that is 5 vaccine champions that will be working with them. So the 10 vaccine champions select 5 vaccine champions from the world settlements. So 5 times 320 will give you 1,600 settlement vaccine champions. So you are the master trainers, you are the 32 master trainers. Your vaccine champions are the 320 vaccine champions, and their vaccine champions, who are also yours, are 1,600 settlement vaccine champions. Did I make myself clear? Am I clearly understood?
Yes, ma'am.
Did I communicate?
Yes, but it is a bit confusing. Can you just start from the state level? How many LGAs are to be selected down to the wards, the vaccine champions? Can you just a summary from the state level to make it a bit clearer? Thank you, ma'am.
All right. Now,
again, what I want to say is that these slides are very, very important to us, because I don't know how the slides will be sent to us to study as after the lectures.
All right, sir. You know that yesterday we sent the slides down to you, right? Today we are going to do the same. We still give you the slides. You know, I'm supposed to have 30 minutes, but I've requested for extension. I hope you also extend my time in your head so that everybody will clearly understand this. It is very important. Somebody said I should repeat it.
Yes,
Please
ma,
permit
please.
me to go to the next, sir.
Yes, ma, please.
Yes, ma. Yes,
1
ma.
minute.
Don't worry. By the
Please,
time I
1
get to my
minute.
next slide. Don't worry, when I get to my next slide, the whole of this training is about repeating myself. I'll keep repeating myself. I'm sure you're going to understand what I'm saying. We'll still have questions when I finish. We handle it. Everybody must leave there very clear and very clear about what we want to do. So in all of these, what we expect is critical pool of CSOs / vaccine champions who have been equipped with HPV vaccine knowledge and mobilization strategies. Then we expect to have an increased knowledge of HPV vaccine by the time we train all of these people, and increased HPV vaccine acceptance, community inoculated against myths and misconceptions. And then, of course, there will be increased vaccination coverage. That's the whole essence of this training. Now, I don't think you can. Suleiman, I need you. Okay, can you see my screen? Now, I was saying something about selecting the vaccine champions, blah, 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 all of that. Now, what you are going to do immediately you leave this place is this. We are going to give you an introduction letter that you have been selected to do this in your state. So with that letter, you go and meet the state health educator in your state, who will also connect you with the SERIC PM, State Immunization Routine Immunization Coordination Center Program Manager. That's the SERIC PM, or the State Immunization Officer. And all of these people, you show them your letter, and they will take you to the Executive Secretary of your state, who is in charge of the state primary healthcare agency in your state, right? So that is the channel you are going to follow immediately after this training. So immediately after this training, we're going to give you official letters backed up from MPSCDA that will take you on this journey. So your starting point after this training is the state health educator, the SERIC PM, SIOs. These are the persons you liaise with, and they introduce you to executive secretary. Please, you have no right to go and start anything in the state except you have met these people. We had issues where some CSOs just jumped into state in the phase 1 and started activities. You will be declared illegal. So please, we are working with them. They are aware that you are coming. They've been informed. So go to them and identify yourself. Meet with them and work with them. So immediately you liaise with these people, the state team. The state team will now work with you to select the LGA that you are going to be working in. Assume like the Nnewi person that spoke, or the Idemili person. We know that you are from Idemili. Maybe you may be from Idemili, you may be from Nnewi. But the issue is this. This state team will help you to say now, where we will need this thing more is in Nnewi, or where we will need this is not in Nnewi that we need this activity more because of the benefits accrued to it. We need it in a more remote LGA, or we need it more in this LGA. They are the owners of the state. They understand better. So that is why you have to work with them to select the states, to select the LGA. So most likely they might give you the capital of that state, and they will not give another remote area. But whatever one they are going to give you, you will have to discuss with them, especially when it comes to the current situation in the country, which I'll be talking about in the next slide. Now, at the LGA level, when they have introduced you or told you, okay, you're going to work in Idemili or you're going to work in another LGA, you go down to that LGA, pass with your letter, and introduce yourself to the LIO, the local immunization officer or the social mobilization officer. These are the people that will introduce you to the primary healthcare coordinators at the LGA level. Are you understanding me? So when you get to the LGA, these are the persons you will meet, and they will tell you that, yes, thank you, you're welcome. They're already aware that you're coming. Even if they're not aware, your letter is speaking for you. The state has introduced you, so they would have briefed them. Then you tell them that I'm here to do this. So together with them, you now work and identify the ward. So having selected the LGA in collaboration with the state team, you come down to the ward and work with the ward team, you come down to the LGA and work with the LGA team to select the ward, the 10 wards you are going to be working in. So in collaboration with the LGA team, you randomly select 10 wards. In all honesty, you can decide to use a simple random selection method just to be fair enough. You can suggest that so that we will not be biased. Just the way we also use simple random selection to select 16 states for our funders. So you can also use simple random selection to select 10 LGAs. You pick, you remove, you replace, you pick, you remove. You know how simple random system works.
10 words.
To select 10 words at the LGA level. Like I mentioned earlier, each LGA may have more than 10 words, but you can only work in 10 words. That is what your funding covers. But if you on your own as a CSO you are rich enough, you are funded, you have that zeal, and you want to cover more than 10 words, It's allowed. But we're just saying for this funding, for this training, for this project, you can cover 10 wards. But if you can cover the entire state as a CSO on your own, good, go ahead. There's no problem with that at all. But know that we are funding for 10 wards, or this project is meant for what? 10 wards. Now, of these 10 wards, you are going to select a vaccine champion from one of these 10 wards. So one vaccine champion per ward. And you are going to collaborate with the primary healthcare coordinator, the local immunization officer, the ward focal person, the health educator, community leaders. All of these are the persons that you can seek advice from or directions from on how to go about selecting these 10 vaccine champions. Remember, that this training of, when you select these 10 vaccine champions, I'm still coming there, we'll also come and assist you in training. You are going to organize training for these 10 vaccine champions that you have selected. After you have trained them, they on their own will also have to select 5 settlements, who we call, out of that 5 settlements, they will select 1 vaccine champion each from each of the 5 settlements. And these vaccine champions they are selecting from the settlements are called settlement vaccine champions. Remember, the other 10 are called world vaccine champions. These 5 now are called settlement vaccine champions. Please note, the settlement vaccine champions, their work, we are not going to give them too much of training and all of that because their work is very simple. That is why your vaccine champions and you will be the one that briefly talk to them and brief them on what is expected of them. Let me go back and say, even your vaccine champions, their training is not going to be as intense as your own. We already have tools that will be used to train your 10 world vaccine champions. It's not going to be as elaborate as this your own, because want to believe they are not, permit me to use this word, they are not as educated as you are, and they don't have laptops to begin to sit down. You don't have projectors to begin to share slides, project slides, and do this elaborate training. We're just going to give you a guide that will help you give them the necessary tips they need for this project. Their activity is more of physical activities that has to do with sensitization activities and mobilization. You are the one as the master trainer, you're going to do advocacy, you're going to do sensitization, you're going to do even mobilization. So you just give each of them, the world vaccine champions, you give them the training that is expected of them. Then for the 5 settlement vaccine champions, you also give them the little training that they need, because their major role is to be, they will be attached to the vaccination teams from the LGA. Every LGA, during the campaign, during the implementation of the vaccine proper, that 1 week when the HPV vaccine will be implemented in every state, it will last for 1 week. So these settlement vaccine champions are the ones that will be attached to each vaccination team. They'll be with the vaccination teams. Their work is just, because they are from that settlement, the criteria you must use. These 5 settlement vaccine champions must be from that settlement proper. They must be indigenous of that settlement. Even the world vaccine champions must be indigenous of that world. Because we want a situation where a community member will come and say, or a world member will come and say, I know this person. Permit me to use Igbo. Oh yeah, Wada Njoku. I know him. He's very good in health issues. That's why. If he's the one telling you people this thing, go, let's go and take. I trust him. I know what he can do. We know this person as the son of so person. We know him to be the son of Chisa, or the son of this person. You know, he's good. He's a medical doctor. In fact, he used to be a nurse. That man used to be a nurse. We know him very well. He's good at this. So let's go and take. If he's the one talking, no, don't worry. You know, so that's the reason they must come from there, because the settlements, the communities must know them. So their work is to be attached to the vaccination teams, and they'll be the ones going house to house, school to school with the vaccination teams, church to church, mosque to mosque, to say, please, these people are here, this vaccination team, they are here. See them, they are at the market square. Come and bring your children who are 9 to 14, sorry. Come, they will knock on the door and say, oh yeah, they are here, they've arrived, they are at the market square. No, they are now in the church. They are in CMS in that church. Go there and do your vaccination. They will be going, they will leave the team, walk around every day. That's why we call them mobilizers. That is their own work, to mobilize people. And you as the CSO, you'll be going around to supervise all of them and see that they are mobilizing, because they must give you the number of persons they mobilize per each day. We have a tool that you use to collect that data for us. So your job is to supervise, make sure they are mobilizing, they are with the team going out. They are not the ones giving the vaccine. So don't let them to go and sit with the vaccination team. No, their work is follow them, mobilize for them, direct people to where they are. Thank you very much. Now, like I said earlier, ensure that the LGA and the SCSM all right, sorry, I had to some kind of technical hitch here. Now, can you hear me?
Yes. Sir, go ahead. You can hear you.
Yes, we can hear you. Go ahead.
Yes.
We can
Are
hear
you
you.
understanding what I'm saying?
We can hear you clearly, ma.
Clear, but there's observation.
Please put your observations down for me. Once I'm through, we'll now take all the observations, right?
It's okay.
As long as the observation doesn't have to do with your hearing me or your understanding what I'm saying. If it's a question, put it down for me. As soon as we are through, we take all questions. Then I've said, ensure that that you work with, that at the LGA, you work with the SCSM. So you must work with the LGA team to be able to do your selection, especially considering when you are selecting the LGAs, issues like LGAs that have ACSM issues or that have low social mobilization issues, these are some of the LGAs that has to be put into consideration while selecting. LGAs that are in remote areas where people hardly get immunization, they have 0 dose, and all of those things. Those are some of the criteria that we can use to select the LGAs where you work. So when you are working with the state team, of course, they will advise you based on that. But in case they don't do, please remind them. And also be conscious of security issues in LGA selection, following the current risk in Nigeria. Of course, there is the state technical working group have done an analysis of the risk situation. So they are also conscious of the risk-prone LGAs. In as much as we are sending you on this project, we don't extend you to go and we didn't advise you to go and put your hand inside fire. So be careful, be conscious of security issues, and then work diligently. That is why most times, that is why we have decided to choose CSOs who are from these states also. Because if you are from Ebonyi, we want to know that you understand Ebonyi issues very well, and you know where to tread with caution and where to just walk in with your eyes closed. That is why you have been selected specifically from those states. Note also, importantly, note that although we want you to collaborate with these stakeholders, we want you to work with them, but we also trust you to bring in your new approaches, especially with regard to selecting vaccine champions, because we want you to select people who are energetic enough and that can bring in, that can deliver. So we need you to introduce fresh ideas that will also give us the result we are looking for. So you have to work with these people. Don't be careful. If they want to impose people that you feel cannot do the job, please be careful to stand your ground and say, no, this person obviously cannot do this work. Because sometimes they may make selections that does not really, stand out as being unbiased. So be careful to stand your ground where issues of bias or reticism, nepotism, or anything is trying to take over our innocent desire to make sure that people get vaccinated. So the IVAC team will come down to the states to assist or to supervise what is happening. We'll come down to make sure that these processes are well coordinated and done the way we have explained it should be done. So we'll be there to supervise, and we'll be there to also encourage you, especially during your training. We'll be there to support. So please, be very careful that it is done the way it's supposed to be done. Like I said, there'll be step-down training. After this training, you are going to go down to your state and then train the vaccine champions that you have selected. So we will be there to support you by the grace of God.
Thank you, Dr. You have 10 more minutes.
Remember, my time was extended. So
yes, we've added that to
talk about. All right, thank you, sir. We want to talk about identifying suitable vaccine champions. Ladies and gentlemen, I've spoken extensively about vaccine champions. Of course, like we said, they are supposed to select one vaccine champion from each ward based on the following criteria. This vaccine champion must have influence in the community. You know, there are some people they call community nurse or community doctors. They are not medical doctors, but people trust them. Maybe they were, all these metron, or these ones that have, they even have, what's it called, maternity. Those kind of women or men who are renowned by the community to have, to have something to do with health. Those are the likely persons you can choose. People that the community respect their opinions. Old teachers, retired teachers, people that command respect within the community. They have track record of advocacy. There are some persons that, yes, they are not in the medical sector, but they are known for mobilizing people for any kind of activity. When they want to do election in Nigeria, in fact, anybody where they campaign for must win the election. So those are the kind of people we want you to look at that can, pick this thing, go out there, sensitize people, and people can listen to them. Then we also want you to select people who are willing to do this thing. There are some people that are just in it for the money. They just collect it and they go home. I don't mind them, I don't go collect the money. No. People that, if you look at those pictures we saw on cervical cancer, you agree with me that this is a very serious issue. So we need people that can buy this idea and run with it, not just for the benefits they are going to get, the material benefits, but for the fact that they have seen need to protect their communities, their sisters and brothers from this. I don't know, can somebody also tell me some other criteria we more used to select our vaccine champions? Please quickly, can you drop for me on the platform, on the chats box? Quickly drop for me. What other criteria do you think we can use? Quickly, I'm watching. What other criteria do you think we can use to select these vaccine champions? People that are available, availability, yes. Someone who is trusted, thank you very much. Someone who is trusted. Age, not too old, middle ages. Not too old, right? Middle ages, right? Yeah, somebody that can, of course, go around. The youth activists, good. People with means of communication, good. Healthy and strong, yes. Good communication skill, very important. Focal or who are focused, people that are sociable, good. Respected personalities, very important. So those are the kind of persons that we can take from this. Consider people from both religious backgrounds. Thank you very much. So those are the people I love. I love the inflow. Keep it up, keep it up. So those are some of the persons that we can use to that we can select as vaccine champions. Now, in summary, the CSO training approach will look like this. 32 of you are being trained from 16 out of the 21 states. You are being trained. Each of the 32 who has been trained. We go and train 10 vaccine champions who have been selected from each local government, each ward in the selected local governments. Remember, we said you select 10 wards from the local government. So you select one vaccine champion, one ward vaccine champion from one of the wards, making it 10 of them. So you do your training. Then your community activation, my colleague has spoken so much about this in the previous class, but remember that you conduct community activation in the dialogues with the wards and communities in the LGA. My colleague did mention you're meeting the community leaders. So you will engage and activate religious leaders, men groups, women groups, youth groups, schools, out of school adolescents, teachers, PTA meetings, and other stakeholders that can promote vaccine sensitization. Now, during the HPV introduction in the last phase, we had a situation whereby schools closed their gates to the vaccination teams because PTAs left instruction that their children must not be vaccinated. Ladies and gentlemen, this is a lesson we learned from the previous one. We don't want to encounter that. That is why we are informing you ahead. Please, storm schools. Let the PTA be aware of what is happening, enlighten them, inform them, sensitize them. If they are aware, they will not close those gates. Please, let the schools, because we are relying on schools to be able to get these girls. Most days they go to schools. We're also relying on the churches. We're relying in the market square. We're relying at bus stops where out of school girls can be seen. Who said you cannot go to the farm? Some of these school girls are there. Some of them are at the bus stops hawking. Those that don't go to school. So apart from the schools, where are other places? Please, can somebody tell me where are the other places? Let's go to chat box. Tell me other places we can get these girls apart from school. While I'm waiting for that, the whole essence of all of this is for us to have critical awareness about what? Yeah. About HPV. Please mute yourself, mute yourself. The whole essence of this is to raise critical awareness about HPV vaccine with the trained CSOs, then inoculate communities against myths and misconceptions. Good. People are saying IDP camps, good. The mosque, yes. Churches, good. Religious gathering, motor parks, markets, water points. We can get them in the markets. Thank you very much. These are wonderful places we can get these people. So let's go there. So the whole essence is that before even this vaccination in May, it will be happening in May, most likely 27th of May. We are still watching the dates. We hope it doesn't change. Now, we want to believe that arising from this training, you help us to go in there to demystify and correct misconceptions that have been raised. The lessons we learned from the phase one shows that some people went ahead. You see this Brekete video. There was this Brekete, you know the Brekete man now. There was a video that came out from there and went viral, where people were saying it's bad, though they want to use it to reduce our population. It will affect, Bill Gates doesn't want our the population of Africa to rise. That's why he's looking for vaccine to kill all of us. Gentlemen, I'm sure Bill Gates doesn't know Chisa Iboleko. Neither does he know you. I personally don't think Bill Gates is interested in the population of Africa reducing. Have you ever thought of what he's going to get or lose? He has a lot of his companies here that is thriving on our population. So why should he want to reduce it? Please, permit me to say that we have to work on this, because by the time we went back to Berekete to debunk that video, the man realized the importance of the vaccine. He came out publicly again to say, please, people should go ahead. Please go and collect this. I've learned now the importance. Please go. People started going. So ahead of time, begin to sensitize people because of the different rumors that will come out. And we want to see that you raise community champions who will take this personal and run with it and make sure that at the end of the whole thing, we have increased HPV vaccine uptake for our communities. Now, I have said that master trainers, you are the master trainers, and vaccine champions are encouraged to conduct HPV mobilization activities in their selected wards. Activities will be tracked by the monitoring dashboard. My colleague, by tomorrow, will give you a training. My colleague did mention something about ODK. So you'll be trained on how to use ODK tomorrow, because ODK will help us ensure that these activities are actually being done where they are expected to be done. So, ladies and gentlemen, we expect that you, the master trainers, and your vaccine champions will conduct a minimum of 4 sensitization activities per week within your selected LG and communities. So please, and you will report all of these activities for us. So this online training is actually meant for 32 CSOs, consisting of 2 competitively selected civil society organizations from each of the 16 states in Nigeria. But the 32 master trainers will now cascade this training to 10 vaccine champions operating within their area council, within their LGAs. So the 10 vaccine champions will also identify 5 vaccine champions from 5 unique settlements in their wards to conduct HPV vaccine mobilization. So that will total 50 of them in each of the LGAs. There'll be 50 settlement vaccine champions who have been selected by your world vaccine champions. So when you 50 of them plus your world vaccine champion, that'll be 60 from each ward working. So master trainers, world vaccine champions, settlement vaccine champions will activate the communities and generate demand for HPV vaccination. That is the whole essence of this training. And as a way of wrapping up, let's look at what the expected deliverables are. You have to give us your training reports. We need to see action pictures from whatever you are doing. We need to see the list of your selected vaccine champions and even the world vaccine champions. We must see the list, the names of those people. We must see activity reports from these vaccine champions. We went to the market today. We went to the school today. We went to whatever the name of the school is. We need to get information of what they are doing. Engagement with vaccine champions, report from spot checks. Whatever they are doing, sensitization rally, we must have those information. Weekly updates of their sensitization activities using the data reporting template and the ODK app, then reports from the implementation week. That week of implementation is very important to us. Ladies and gentlemen, you must give us the reports coming from that week of how many people are being vaccinated. Thank you very much.
All right, thank you, Dr. Chisa. Thank you so much. So before we go, okay, next we have the questions and answer section. So we'll be taking 6 questions, 3 at once, at a time. So Dr. Chisa, I have a question for you also. And my question goes to us. You made mention of TWG. What does TWG stands for and what do they do? And also before you said something about before we go into this, do the states have a body that is in charge of this introduction that we need to work with? What is their name and how do we get in touch with? How do we how are we going to be integrated into this group? Thank you.
All right, thank you very much, Dr. Pius, for that sensitive question. Now, TWG means the Technical Working Group. Every state has a technical working group. You know, I did mention that for this training, we are going to give you an introduction letter. Actually, that introduction letter, you're going to take it to the state team, whom I have mentioned earlier, the CERIC PM, the SIO, who will introduce you to the state secretary. The whole essence of that introduction is to eventually integrate you into the technical working group, the state technical working group. The state technical working group is the group that is responsible for coordinating all of these immunization and HPV vaccine activities. So you are going to be attending their meeting going forward. You are going to be working with them. They'll be doing mapping and all of those activities to ensure a successful HPV vaccine. You will be part of it. So your letter is taking you not just to those state teams, it is also stating that you should be integrated into the state technical working group, so that going forward, you attend all their meetings, all their reviews, and you'll be part of all their plans for this HPV vaccine. Dr. Pius, did I answer your question? Thank you very much for that question. Dr. Pius, are you still there? All right, if Dr. Pius is not there, can we have questions? Let's have the remaining three. I'm sure you have understood what I mean by state technical working group, the TWG, and how you are going to be integrated. Let me have questions from.
Okay, my name is Vivian from Hakara Carewell Initiative. Please, I want to know, ma.
Please go ahead. Tell Jenny to step in. Vivian, we have lost you.
Okay, can you
We
hear
have
me
lost
now?
your voice, rather. We can hear you now.
All right, ma, thank you. So I want to know the duration of this program from the entry point to the week of vaccination proper. How long? From when to when, ma? Please.
All right. Thank you.
Thank you.
Next question.
Yeah,
My colleague Janet will step in to coordinate this.
Okay. Good morning. Good morning,
Okay,
everyone.
hold on, please. Okay, we are going to take Mr. Emeka Chukwu, then followed by Doris Igwe. Mr. Emeka Chukwu, go ahead.
Okay, good morning, everyone. My
Good
name
morning,
is
sir.
Chukwu. Yeah, my name is Chukwemeka, the Executive Director, Good Software Heart Health Givers Empowerment Initiative, Urban State. So I just have two questions. First one is to know, I want to know who are the people that are going to administer this vaccine for the target population. And also, second question is, we know very well that our target population are the adolescent girls from age 9 to 14. And I want to know how many persons are we going to reach per local government in this project? The maximum target we're going to reach. Thank you.
Is it you are going to reach for vaccination or for sensitization?
Both for sensitization, yes.
Okay.
All right, thank you, Dr. Chisap. So the next person is Adiveji also. I think you've asked a question. Let's give other people the opportunity to also ask air their views and ask questions. So please, Rhoda.
Yeah. Good morning.
Yes,
Please,
good morning.
my own is a concern based on past experience. I'm actually concerned that the introduction letter is directed to the state immunization officers. We all know that in the government sector, the way they do their own activities are somehow different from the way we do ours. Is it possible for that letter to be addressed not just to him or her alone? I'm looking at past experience. That is one. And the second concern is the technical working group. I want to know, have you people sent the list of the CSOs that will be working in the state to them? I think it is necessary that they have that list, that they will be expecting us. I'm not really going to like search out for them, because to be very candid, sometimes let's just leave it that way. Please, if you can send the list of the CSOs to them first, let them know that this CSO needs to come and see them or bring this later. And to see how that letter they are sending is not just to the state immunization officer alone. That's my question.
All right, thank you. Dr. Chisa, you want to respond to the first three?
Yes, I want to respond to these three questions. Thank you very much. Let me start from the last person who have asked if the states are aware. Please, let's mute ourselves. Now, Ma, thank you very much. We really understand your concern about the awareness from the states. I can feel you. Trust me, whatever we have learned from the previous ones, we have taken note of that. Already from this training, immediately after this training, the state technical, that's even why we invited this state team. Some of them are part of the training
Hello,
today.
madam.
The CERIC PM.
Excuse me, madam.
Sorry, please, you'll be given opportunity to ask questions that you want to ask, please. There are other people. Just wait for your turn. Thank you. Dr. Chisa, please continue.
Thank you, Dr. Pius. So I was just saying that we invited the state team for this training. I'm sure some of them are part of this training, and we are also going to inform them ahead of time before you arrive. They'll be expecting you. Yes, we are going to send your names to them. NPSCDA will also back you up as you go there with a letter, and our letters will back you up. Of course, it will be addressed to relevant persons as suggested by NPSCDA, not just the immunization officer alone. So we are taking cognizance of that. It's part of the lessons we learned from the last training. You had the NPSCDA person that came to give the goodwill message yesterday. NPSCDA is the body coordinating all of this, so they are very much aware. They are going to give you the right introductions, and so that you can walk into this technical working group and integrate with them successfully without any hitch. You ensure that happens. Don't worry about that. Then somebody said, how many persons are we going to sensitize? I don't know how many persons are in your community, but what we want is that in whatever community you are working, let everybody in that community hear about this. In whatever community you have selected, if you are working in a ward, let everybody in that ward hear about it. I don't know how many the population of your ward, but please let everybody hear about it. Make the noise. Let the noise be loud enough to get to every member of the community. That is why you have your vaccine champions. That is why we have said you will do sensitization activities, a minimum of 4 in every week. You go to church, you go to different churches, you go to different mosques, you go to different schools, all of those places. Please reach out to as many as possible. For the vaccination proper, you know that the eligible girls are between 9 to 14 years. So they are the ones that will get it eventually. But we want their brothers to hear, we want their mothers to hear, we want their sisters, everybody, their uncles, their nephews must hear and encourage them to go. So for the person that asked me, who are the people that are going to administer the vaccine? NPSCDA, like I said, is in charge of the HPV vaccine introduction in Nigeria. They are also going to train the health workers. NPSCDA is doing that. So the health workers are the ones who are going to do the vaccination proper. You are not going to give the injections. No, you are going to work with them. Your work as a civil society organization is sensitization and mobilization. Just the way we are training you now. Health workers are also being trained. Every other sector that is involved in this is being trained. So when you get there at the local government, you will see that every other sector is prepared and ready for this. Even traditional rulers will be trained. Different sectors are being trained by NPSCDA. Trust me, a lot of preparation is being done for this. And at the end of the day, everybody will play their role. So your role is not immunization. Your role is sensitization and mobilization. Health workers, we do that. We administer the vaccines proper. Duration of this program. Thank you very much for that question. Now, let me state here that immediately after this training will be ending on Saturday. Subsequently, we are going to be doing a lot of communication on that WhatsApp group that has been set up. Now, immediately after this training, there's something we are going to call social media sensitization. We expect, that's why by Saturday, you'll be giving training on social media. After this training, we're going to have social media sensitization for a period of almost 1 month and beyond. Because we expect that you, the CSOs, will bombard social media with this information. So we are going to be having different activities with you, and you on your own will also be having your own sensitization activities on social media. That's where we're going to start from. So you will organize, every week we are going to give you the kind of social media sensitization that we expect that you are going to do for that week. So you do it, either that you do a quick interview with a parent, just to, do something. My colleague who will be taking social media will come up with the different activities that will be done. So the social media sensitization activities will last for almost the next 1 month. Now, after that, we are now going to come down for your training, for the step-down training at the state level. My team members will be there, will be deployed to the state to assist and monitor your cascade training for these 10 vaccine champions. So immediately after the training for the 10 vaccine champions, which will be happening like 4 or 5 weeks before before the implementation proper. I did mention that the implementation is 27th of May. That's the date we still have for now, except NPSCD says otherwise. Now, between the time we come for your step-down training at the States, there will be a month. That will be a month to the implementation proper. So that month is going to be filled with physical sensitization activities in these states, in these LGAs, in these wards where you'll be working. So like I said earlier, we're going to start with social media first, which will last for almost 1 month. It can still continue, yes. After which we go into physical sensitization, which will last for another 1 month. Do you understand?
Yes, we're with you, Dr. Tisa.
Thank you.
Yeah, Dr. Pius, please let me just make a comment. Thank you, Dr. Chisa, for a wonderful session. Thank you, Dr. Pius and Janet, for facilitating the session. Rhoda, I think Rhoda still has some concerns. And also, when she made a comment, she didn't tell us the alternatives, the other persons to whom the letter could be addressed. She didn't mention, but I think she still has some reservations. I think she dropped the chat, so maybe she could actually complete her thought on that so that we can properly situate that. And then also, I know someone also asked the question that what's the target population, the size of the population that they need to meet at the world level. So when you get to your local government, after you've been assigned a local government, you can work with the primary healthcare coordinator. They have a map of all the wards, and then the immunization officers, the LIOs, they also know the number of persons per settlement. They do those mapping regularly, to be able to distribute for vaccine logistics, so they know. So you can ask them. So I think if you do a captive population, say more than 50% of the total population, I think you would have done well. Thank you. So, Dr. Chisa, I think we should still get a feedback.
Thank you, Dr. Chisa.
All right.
All right, thank you, Dr. Chisa.
All right.
All right, Dr. Chisa. And let me also add that the MPSC, they have a target for the MAC campaign for each state. And there is a daily calling data for the 5 days campaign, and then maybe 2 days mop-up that is going to happen in each state. So for each ward, there's a calling data that comes in every day. So we expect that your own local government, where you are covering, provides a large chunk of the calling data. So that means that will show that you are working. We expect that at the end of the campaign, we compare your own LGA to other LGAs. Surely to be proportionate to your population. We'll compare with other campaigns and see that you've done a lot of work, you and your vaccine champions. Thank you so much. Dr. Chisa.
Did we lose Dr. Pius's voice?
Sorry, we'll take 3 more questions, including our own pharmacists. So
all right.
Sorry,
Dr. Pius, before we take the question, please, let me pause here a bit. I want to say that the previous speaker who spoke before Pius is the Managing Director for Direct Consulting and Logistics, Dr. Joseph Olisa. Thank you very much for coming on board this training. Yesterday, he didn't introduce himself. I want to give him the opportunity to, if he can, unmute himself, enable his video, and say hi to participants.
All right. Thank you very much, Dr. Chisa. Well, thank you everyone for participating actively in this training. I think it's been It has been a wonderful.
Please, I cannot see your face. Please, can you activate your video so we can see you? Thank you.
Well, I'll be coming live maybe before the end of the training. Yeah, I can activate my video right now.
Thank you, sir.
Yeah. So, but Dr. Chisa, thank you very well. I think everyone is doing very well. We are very impressed with the turnout and with the participation so far. There's this level of seriousness that is very palpable, and we are very optimistic that we're going to get the best out of this training. Thank you all. Thank you, everyone.
Thank you, sir.
Thank you, Dr. Joseph. So, pharmacist, you have a concern or you have a question?
Thank you, sir.
Hello, pharmacist. Mama. Okay, I think we'll move on to the next person. Doris Igwe, please, you can ask a question. And then after her, Chima Henry, and then the last person, Glowhawk NGO. All right, Doris, you can ask a question now. Unmute yourself and ask a question.
Okay, thank you once again. One of my questions has already been taken care of. Just the only one that is remaining is the. Hello, I've already done that. Are you hearing me?
Yes, we can hear you. Go on.
Okay, thank you. One of my questions has already been taken care of. Just the remaining one. Okay, based on this, our activities, these people, the vaccine champions, they're supposed to be our volunteers, but for the sake of these activities, they are vaccine champions. On this, I want to find out how are they going to be taken care of? Are we going to pay them, or is it just going to be a free job so that we'll know how we.
All right, thank you. All right, thank you so much.
Thank you.
All right, thank you very much. Chimak Henry, please, you can ask a question.
I am Chima Henry. Thank you, Dr. Chisa, for that wonderful presentation. Mine is just a concern. In one of your presentation, in one of your slides, you did mention that the state team, when we meet them, we choose the LGAs or the wards where this vaccination and mobilization activities will go on. But I just want to suggest, because of past experience, human bias and all that, politics, that your organization can come up with a set of criteria for the selection of those LGAs to be shared between the CSOs and the state team, such that by the time we will be meeting with them, we will know that the selection is based on this set of criteria, like low ACSM, low immunization. Just you gave examples, but I would want it to be a direct. What I am suggesting is for it to be a direct and a direct communication between your organization and the state and the primary healthcare development agency, and down to us, such that by the time the CSO go to the state team, they will know that these are the criteria through which the LGAs and this thing will be choosing. Because we've had situations whereby you go to meet someone at the state level, the person will prefer for this activity to go on in his own LGA where he is from. So that is why I feel I suggest that this criteria be well spelled out, so that there won't be clash of interest, and we'll be able to manage the expectation of different stakeholders at the state level in making these choices.
Thank you,
Hello?
Chima. Thank you. We can hear you. Thank you.
Secondly, hello, are you there?
Yes, we are here. We can hear you. Go on.
Secondly, you also mentioned something about a school locking the vaccination team out and not allowing them to do the vaccination. I also think there is also need, if that has already not been done already, for the states, the organization to liaise with the state's primary health development agency to also reach out to State Ministry of Education, because from our experience, with this the ranges of the age range of the kids, the people who will be targeting. A good number of them for my state, Anambra, are most likely to be of school age, and
is
they will
it
be in
me
school.
or is it Chima? Is it Chima? You are breaking.
Okay,
We
can
can
you hear
hear
me?
him. We can hear him. Yes, we can hear him.
Maybe
Okay,
from
okay,
you.
continue.
Okay, what I'm saying is that I think there should be a clear collaboration, or the primary healthcare agency can reach out to the Ministry of Education. We have done that in Anambra here in one of our interventions, and the letter will be written to the head of primary, the head of schools, private and public schools, to say that these are the things. This team will be coming for vaccination. Give them access, because one of the problems we do have in things like this is that parents don't want their kids to be vaccinated. In some instances, you go to school, there is an implicit order that to the teachers or the proprietors of the school not to allow anybody to do anything to vaccinate or give any form of anything to. I understand their fears, but I think part of the ways to allay that fears is for the states or from the national level, from your
Can we make
organization.
it brief? Make it brief so that other people can talk with us, sir.
That what I'm saying in essence is that if the Ministry of Education can be reached out to at the state level, so that there will be letters circulated to the private and public schools,
it's okay
for that awareness to be there. That is it. Thank you very much.
All right, thank you so much. So we'll give the next person is Glowhawk NGO. Please unmute yourself and ask a question. But we'll also be giving. We'll take the fourth person. This Basil Jigini, because he has been the one trying to say something from the onset. So go ahead, continue.
Thank you very much. I'm Christy Abayomi Oluwole, the CEO ED Glowhawk. Honestly, I must say we are really we really had a wonderful time. But then I just need a little clarification on one, then maybe a suggestion on the other aspect of my discussion. The first thing is each state is supposed to work in 10 LGAs, and each master trainer is supposed to train 10 world vaccine champions, who will in turn train five settlement champions. So I'm now asking, since we are two CSOs per state, does it mean per LGA we'll be selecting two wards per LGA out of the 10 LGAs, so that one person, one of the CSOs handles one ward, then the other CSO handle the other ward, since each of us is expected to train 10 world champions each, and we are working in 10 LGAs. So I want to know if we'll be working in 2 wards per LGA, where each of the CSOs will be handling one ward. That's my first question. Then
Thank you,
second.
Thank you, ma'am.
Please.
Continue. Ask a question.
Sorry. Secondly, apart from the question I asked, I'm looking at the social mobilization strategy also, because of resistance and because of past experience. I want to ask, is it possible we strategize and bring in some mobilization strategies, like maybe radio jingles to sensitize the populace, or maybe like community theater groups, or using NYC theater group, or even state theater art group to further take the message homes to the people. So, because at times when people see the theater troupe driving the message home, telling them the dangers of not immunizing the girls against this HPV, it will also help us to get much acceptance than the resistance that we get. So that's all I have to say. Thank you very much for the privilege.
Thank you, ma'am. Dr. Chisa, please, you take one last person. Sir Basil Jigini, please, you can ask your question.
Hello, madam.
Yeah, we can hear you. Go ahead. Ask your question. Hello, Sir Basil, you've unmuted yourself. Okay, Dr. Chisa, maybe we'll take him another time. Please, you can go on and respond to the last three questions. That's the last three questions. The last three questions we can take for this section.
I suggest seriously that if we are writing a letter of introduction to a state, let that letter be directed to Ministry of Health Permanent Secretary, who would download that information to the state health educator and to the immunization team that will go onto the local government, the technical team. Without this, there might be a confusion as to the identity of those who are assigned to do this program.
Thank you, sir. Thank you very much.
Thank you very much.
All right, Dr. Chisa, can you really respond? Please respond to the questions.
Right. Thank you very much. Very interesting questions. Thank you. I'm going to start from the last question as usual. So yes, introduction letter will be written. You remember, we have always been mentioning it in this training that we are working in partnership with National Primary Healthcare Development Agency, NPHCDA. We are working with NPHCDA, the National Primary Healthcare Development Agency. They are the ones in charge of this HPV vaccine and of course every other health issues. Now, NPHCDA, of course, is going to advise us on who this introduction letter will go to, because practically they are the ones that will write this letter. So they understand who should be addressed and the hierarchy that letter will follow. So don't worry. We are going to work with them and we decide on whether it's going to be Ministry of Health or all those people that have been mentioned. Don't worry. We must make sure that the letter is addressed to the appropriate person and in such a way that you will not have issues when you get to the states. So we are working with the national body that is in charge and we'll get appropriate directives as to how the letter will go. Then somebody said something about using social mobilization, using jingles, using theater arts group, using all those things. Very good. They are very wonderful means of sensitization. But please, we want to let you know that for this particular project, immediately after this training, we are going to call you for a quick meeting where we'll be reviewing your terms of reference, TOR, that will be issued to you. That terms of reference will contain all the expectations and the seed funding that will be attached to every expectation. We want to state here that in as much as we admire the use of data groups, radio jingles, we also want to state that for this project, you stick to what we can afford or what we can fund or what we have specified in our TOR that these are the things we can fund. But if on your own, as a civil society organization who is very keen about, the health of the people and reaching to communities, and you want to use those groups or that jingle to reach out to them, why not? You can go ahead. But our TOR is going to specify for you the limits to which we can afford for this project. Now, the other person asked me a question touching on the vaccine champion selection and 10 words. And I'm sorry to say this, Ma, it's obvious that you didn't join when I was doing my presentation. Or if you joined, you didn't understand me. Please, Ma, I did not say that you are going to work in 10 local governments and you are going to select two words. I never used 10 local governments and I never used two words. For more understanding, let me take it again. Two of you, two civil society organizations have been selected from each state. There are 16 states in all for this project for now. Two CSOs have been selected from each state. Each of these CSO will work in one local government. Imperatively, it means that 2 LGAs will be covered in each of the 16 local governments. 1 CSO per LGA. Sorry, in each of the 16 states, 2 LGAs will be covered in each of the 16 states. 1 CSO per 1 LGA, making 2 LGAs in 1 state, 2 CSOs in 1 state, 1 LGA for 1 CSO. As side talk, let me also say there might be another training for youth. You might see a youth appearing in your state if what we are expecting happens. That one is by the way. So for this CSO thing, we have 2 CSOs in 1 state. 1 CSO per 1 LGA. Now, 1 CSO who is working in 1 LGA is expected to select 10 wards from 1 LGA where he or she is working. 10 wards, not 10 LGAs, please. 10 wards. You know, after state, we have LGA. After LGA, we now have ward. After ward, we now have settlements. State, LGA, ward, settlements. So every CSO in 1 local government, we select 10 wards. And then those 10 wards, the vaccine champions, you select 1 vaccine champion from 1 ward, making it 10 vaccine champions. Now, those 10 vaccine champions, we now select from each ward, they will now select 5 settlements in their ward. We call them 5 unique settlements, whom will be selected based on maybe reasons that they are remote, they hardly get vaccination team going there. So this time around, I want to make sure they get, let's select them. It could be that their population is large. They have a lot of 9 to 14 years. So let's go there. It could be that they have 0 dose immunization record. So let's go there. So those are some of the reasons that can inform the selection of these settlements. You are in this settlement, you are from there, you know them better. So those 10 vaccine champions who have been selected from the wards, we select 5 unique settlements. And then we select 1 vaccine champion from each of the 5 unique settlements, making it 5 vaccine champions, 5 settlement vaccine champions. Now, what we have is that we have a CSO in each LGA who select 10 world vaccine champions. The 10 world vaccine champions will now select 5 settlement vaccine champions. But be sure to know that you as the CSO is controlling all of these vaccine champions, both the world and the settlement. You are in charge. You are the one monitoring them, supervising them, and giving us reports about their activities. Ma, did you understand what I'm saying now? Please, I want the person that asked me this question to personally respond.
Hello, Madam from Glow Up NGO. I hope you understand her now. You understand the process.
Thank you
Please,
very
Madam,
much.
unmute yourself and answer.
Okay, thank you very much. It's clear now. The confusion was in the number of LGAs, and it's very clear now. I understood
Madam,
the
is 1
word.
LGA.
Next.
All right.
All right.
What I'm trying to explain, I said I got it from the word, the confusion I had initially was that I didn't know that it was 2 LGAs per state. That means 1 LGA per CSO. That was where the confusion was, and it's clear now.
Thank you very much, ma'am. All right. Somebody asked me a question about the primary healthcare agency collaboration with Ministry of Health. You see, like I said, this whole immunization, HPV vaccination thing is being coordinated by the National Primary Healthcare Development Agency, NPSCDA. And trust me, NPSCDA on their own as the organs for this particular HPV vaccine are doing everything and coordinating and cooperating and collaborating with all ministries and departments and parastatals in the health sector. So what we are doing as an organization is just to anchor the CSO aspect of, which is just a minute aspect of it. And that's why we are also working with them. So MPSCDA, in their wisdom, are already collaborating and working with Ministry of Health, whatever names they go by in the states. They have all, even the NTOT is already happening by next week. So they have deployed their representatives in the various states to go and do the trainings that will happen in those places. So all of those activities are being taken care of. If you like, sir, you can call your state now. They are aware that HPV vaccine is coming in May, and they are doing serious preparations for it. So be rest assured that whoever needs to be informed has been informed. As per whether letters will be written to schools, from the experience we learned last year, MPSCDA is very much aware of what happened in schools, and I'm sure they have taken cognizance of that, and what they also want to do. So your role as a CSO, working in this LGA or in this ward, is to go to these schools, like we have said, also, and do your sensitization to follow up whatever letters that MPSCDA would have written to them. It is not in the purview of my organization to begin to write schools. No, that's not our own. But MPSCDA, who is the chief of gas in this issue, already know what to do, and I'm sure they are doing it because I trust their capabilities. So you go to these schools, do your sensitization, ask for permission to talk to PTA where necessary. And if you are given, go there and speak to the PTA meeting if you can. Then on the question that, I need lights. Sorry, give me 1 minute. Now, somebody asked me that my organization should come up with criteria on how to select the words to avoid conflict of interest and all of that. Honestly, I love your concern. I understand your concern. I made a comment during my session, or when I was facilitating, that in as much as we want you to collaborate with all of these people, we also want you to use your initiative and make sure that somebody did not bring somebody because he likes the person or the person is related to him or that's his community and stuff like that. We need you to be careful with all of those things. But we also want you to know that we are just an organization that is funded to do this. There is limit to what we can do in terms of ordering the states on how to do their things. The states have an organized way of doing their things. So when you get there, you will patiently work with them. The only thing is, when they want to impose anything on you, please be sure that that thing is the right thing. If it's not the right thing, please, you can reach out to us. But whether they will be the ones, they know the criteria for selection of some of these LGAs. They know. They know the criteria. They already have what should be done, and they will do it. But if you suspect anything that is not okay, feel free to contact us so that we can step in. But trust me, we are also going to reach out to the SIOs and the SERI PM, and of course, inform them we are coming, and also hear from them on how these elections will be done, so that we'll be sure that they are also going to be fair enough. But there's a limit to what we can impose on them. But like I said, security issues, bias, and some of those things, watch out for them and report where necessary. Then, VCs, how are they going to be funded? How are they going to be taken care of? We had mentioned this earlier, that immediately after this training, we're going to finalize your terms of reference, like a memorandum you are going to sign with us. We will show you these are the things we expect you to do. This is the funding we are going to give for each and every one of them. We're going to list all of these and make it very clear in the TOR. And we're going to send them to you. You will go through. If it's okay by you, you will sign and acknowledge that, yes, this is okay by me. I will do it. If it's not okay by you, please feel free to say, no, I can't take this. It's not okay by me. I will not sign. With all pleasure, we will accept that rejection. So we are not going to force anybody, even after this training. That's why that TOR is there, is to guide these agreements. So whatever you see in the COR, you are not comfortable, you can feel free to discuss with us. If it's something we can change, we will change. If it's something we cannot change, we'll also tell you that this one we cannot change it. If it's okay by you, you go ahead. If it's not okay by you, you feel free to decline and say, no, I cannot participate because you didn't do this. So all the stipends that will be given to VCs, both the world VCs, the settlement VCs, LIOs, whoever you are going to be working with at the world level or at the LGA level will be stated in your TOR. So once you see them, we go through them together. If it's okay by you, fine. If it's not okay by you, you feel free to decline. I hope I've taken all the questions.
All right, thank you, Dr. Chisa. Is pharmacist now back on? Her hands have been raised. Pam? Mama?
Pam is still raising her hand.
I think
Yes.
she has something to say.
Hello? Yeah, can you hear me?
Yes, we can hear you, Mama.
Yeah, thank you very much. Good afternoon, good morning, everyone. Sorry, I've been raising my hand. My comment was based on the presentation, on the question somebody asked about addressing the letter to SIOs, the introduction letter. Sorry, just to state that the letters cannot be addressed to the SIOs. It's going to be addressed to the ES, who is in charge of the State Primary Health Care Board. We only say you penetrate, you reach him through these other officers. And then secondly, when you are going to the LGA, if it's necessary, they can also give you an introduction letter from the state to the LGA, so that to make sure that your penetration into the state and LGA are seamless. So that's that. Thank you. Over and out.
All right, thank you, Ma. Thank you, Pam. Thank you so much. Okay. Hello, Dr. Chisa, are you done?
Yes, I'm done. If you permit me to go, I'll sign out.
All right, thank you so much. That's all the question we can take for today. Please just ask your questions on the chat box, and then we'll respond to them later. So for now, I will be signing off and I'll be handing over to my co-pilots, Janet Adegbola, my very reliable colleague. I should be taking us through the next process. So, and thank you. Hey, Janet, over to you.
Okay, thank you very much, Dr. Pius. We are going to go to the breakout sections now. Okay, before the breakout section, we are going on a 15 minutes break. So for us to go and have our lunch and come back to continue. Thank you all. So by the time we are coming back, we are going straight into the breakout session on community activation strategies. So let's prepare for that. Thank you very much. And
hello, so what time are we coming back?
In the next 15 minutes.
Okay, that means 11:40. We are 11:47 now.
We'll be back by 12.
Oh, thank you so
Yes,
much.
we'll be back by 12.
All right, thank you.
Over to you.
Right. We're all back to the house. Like I said earlier, my colleague Janet will be taking over for me for now. Janet, over to you.
Good afternoon once again. I hope we're able to rest a bit. So we are going to the breakout section. Donald, please can you share your screen so that you can see what the breakout section is about? Donald, oh, okay. Okay, so we have the breakout session talking about community activation strategies and vaccine champion selection strategies. So we have a template where people will be divided into 7 different groups, and you have to discuss, come up with ideas, and fill in on each of those templates on your group. Well, we'll be sending out the links on the chat box for the templates on the Google sheet. So there you will fill it in. We're still trying to divide all of you into the groups. So I'm going to show you what the templates look like now. Can we see my screen, please?
Yes, we can see your screen.
Okay, so this is what the template looks like. We have the important information. Sorry. Important information. Each group should pick a group head who will moderate and present during the plenary sessions. That is, after we finish the breakout session, we have to come back to the general group and then have a discussion on each of the groups, from each of the groups. So the first question is, what are the likely challenges CSOs will encounter during community activations? We will list it out. Everyone have access to this group sheet. Then number 2 is, how can we address the challenges faced during community activation? Number 3, we have, what are the criteria you intend for selecting your wards? Then we have, what criteria do you intend to use for vaccine champion selection? And we have, what are your intended outcomes? So that is for the community activation sheet. Beside it, we have names of the group members. So one person in the group can take up the task of writing out the names of their group members there, and the rest will focus on discussing this, and one person will also be typing on it while everybody is giving their opinion on each of the questions. So following that, the group lead will come back and take the presentation when we gather back for the next session. So that is that. So we'll be dividing ourselves into groups now. We have 30 minutes for this session, this breakout session. I can see courageous women, courageous girls' hands. Sorry, what question? Sorry.
I think it's
Okay,
an old hand. It's been like that for some
no,
time.
it's not
Okay.
an old hand. It's not an old hand. You know, when you're talking about how we can fill this template, yesterday's template that my group filled, I don't think they put down our names. I don't know if it's going to affect anything. When we
No,
did
it
our
won't affect.
presentation, room 10.
No, don't worry, it's enough.
It won't affect anything.
Okay, all right.
It won't affect
Thank you.
anything. Yes. So there are going to be 7 groups. I'm sending the links to the 7 groups to the platform, to the chat box now. We can see it there. It's there now. So let's just check it. And then when you are assigned to your group, you move to those group that you are assigned to and start deliberating. There's an IVAC staff for each of the group that will work with you for this section. So we'll be going into it now. Thank you. The time starts now.
Please, yesterday the joining of the group was automatic. Is it going to be like that again today? Or we have to join tap on a link?
Okay. Good afternoon again. Janet, you are still in this group. I thought you were supposed to be in another group. This is my group. Go and look for your own group. I had this special people. I had this special people, yes. So
Hold on, I'm still
I am
sharing
still
groups.
here too. I am still here.
Did
I'm
it
still,
take you?
I thought I'm supposed, yes, I'm supposed to have been,
Hold on,
it has-
please.
okay.
okay, they are still reassigning, they are still assigning people. Oh, okay. Oh.
Yesu yakunchi. I don't know why I'm finding it so difficult to hear from my angle. I don't know if it's the
No, we've not
network
said
or
we
something
still
is
have
happening.
we still have 48 people in this chat group, so they are still assigning people to different groups. So let's just give ourselves another 10 minutes. Maybe myself, I will be moved to a different group. So they have there's a way they do it. So they are still working on it. Just give them some time.
Hmm.